And we've got to 3:10 at our end, 11 with yourselves. So we'll make a start and reassured that you can both hear and see us. So and it's good that you've joined us. And it's a pleasure to be participating in this conference from rather many miles away. Mind you, that's probably all of us rather many miles from Philadelphia. My name's Donald Findlater. I'm a director within the children's charity here in the UK, the Lucy Faithfull Foundation. And within that foundation, I'm the project director for a part of the organisation called Stop It Now Helpline, and we'll say something about that in a few moments. And I'm one of your co-presenters today for this piece of work to do with the ECSA Project, Eradicating Child Sexual Abuse, which is about applying a public health model and framework to plans to prevent child sexual abuse, both here in the UK, but also globally. And I'll be sharing my screen very shortly when my colleague Willie introduces himself in a second or two. But before getting to that, though, can I just welcome you, number one, but can I also let you know this session is being recorded for your own or for other people's use after the session. So just to be clear about that. And as we do the presentations, as we run through the bunch of PowerPoint slides, some of those slides, we'll have one or two questions to ask you. And we'll be asking you to think about them individually and then to give us some feedback after you've had a few moments to think about the issue we've raised. And we'll use the chat function for that if we can. So please, rather than the Q&A session function, if you look for the chat function on your Zoom screen, then hopefully that will help out. We have Joe here, who's assisting with the technical administration of this task for us. So thanks, Joe, for your support and help with this. Do delegates at any stage ask a question, ideally again in the chat function, if you would. We will take those questions probably in bunches at different kind of like vantage points during the session. So we probably won't interrupt unless it's a particularly kind of pertinent matter at a particular moment in the presentation. And while I'm presenting, Willie will pay attention to the chat. While Willie's presenting, I'll pay attention. So hopefully we'll manage on that basis. I think without more ado, hopefully you're planned for a session that is going to be probably an hour and a half long. So I gather most of the sessions at LEF are, many of them are 50 minutes long sessions. This session was timetabled for up to an hour and 50 minutes. The organisers gave us the latitude to do that. So we're not wanting to waste your time, but we're wanting to engage you in some of the thinking behind our project and the public health framework that we'll present. So it's kind of, because of that wish to engage and grapple and ask and answer questions, that we wish for a little more time. I hope that suits at your end, and look forward to the engagement, but also hearing back from you as this session continues. So that's me, Donald Findlater, one of your co-presenters, and I'll ask Willie if, Willie, you could say a few words about yourself, briefly about your background, probably professionally would it be helpful. And while you're doing that, I'll get our slides up. Yeah.
Jolly good. Thank you very much, Donald. And hello, everybody. I'm speaking to you from just outside Edinburgh in Money, Scotland. Thank you very much for choosing us. We're looking forward to speaking to you today. My professional background is with the police. I'm the law enforcement bit of the LEPH bit. I was in the police in Scotland for about 32 years or so. And latterly, the last sort of 10 or 15 years, mainly crime investigation, but I was also responsible for trying to draw together police, social services and health professionals to work together in the investigation of serious sexual offences and child sexual abuse cases. Plus, I had the responsibility for the management of high-risk offenders in the area using a process which we have here called MAPA, which would be familiar to anybody from the UK, the Multi-Agency Public Protection Arrangements. I subsequently became the national coordinator for those arrangements in Scotland. And we're actually quite good at managing people that we know about. You know, if somebody is risky and or if something's reported to the police or professionals, then we do have systems in place that react effectively to those concerns, and we manage risk quite well. But I became more and more interested in the prevention side of things because over almost my entire police service, we were very reactive. Many reasons for that, but there wasn't much thought given to prevention in any way, shape or form. And around 10 years ago, I became aware of an organisation in Scotland which has just started up called Stop It Now, which Stop It Now in Scotland is under the umbrella of the Lucy Faithfull Foundation. And there was all sorts of projects developed in Scotland with a prevention focus. So for the past 10 years or so, I've been working for Stop It Now in Scotland. And the past 3 years or so, I've been working for ECSA, which we're going to talk about today, Eradication of Child Sexual Abuse, which takes the prevention work to a more global audience, perhaps, a way of putting it. We'll talk about these things in more depth as the day goes on, and I'll pass you back over to Donald. I can see the slides are now working. I can see them. Hopefully you can, and I'll speak to you again shortly.
Thank you very much, Willie. Okay, and just to mirror Willie's sharing with you about his professional background, my background is in the UK in the probation service, designing, delivering sex offender treatment programs. And then I joined this charity, the Lucy Faithfull Foundation, in 1995 to run a residential treatment program for men with allegations of or convictions for child sexual abuse. So child sexual abuse specifically, and treatment programs is my background. And then it was moving from the insights gained from working with those men, working with the victims of those men, working with the families of both those offending and the victims. Often, of course, that's the same people as family members, and taking messages from that work and figuring out what might prevention look like, and how do we go upstream with this task, which has been the journey that I've been making essentially since 2002, when we set up Stop It Now here in the UK. Now, hopefully I'm going to move a slide on, and Willie, can you just confirm that that slide's moved, because in the last presentation it didn't? Yeah.
Yep, that's moved.
Okay, so outline. So this is what we're going to cover off in the session today. Just a little bit about the Lucy Faithfull Foundation. I'll come back to that in a second or two. Then a little bit about Stop It Now UK and Ireland. Just to alert you, there are Stop It Now project in the US, Stop It Now project in the Netherlands, a Stop It Now project in Belgium that's just been expanded from the Flemish-speaking part of Belgium for across the whole of Belgium, but also a Stop It Now project commencing very shortly in Australia. So that's the Stop It Now family so far, each independent project, but all endeavouring to do the same thing with the same target groups. We'll want to say something about the scale and nature of child sexual abuse, just some global kind of comments really about that as a setting circumstance for what we're going to talk about. Want to share some models to understand child sexual abuse and prevention, because the public health model gives us a framework to think about primary, secondary, tertiary prevention, but then the models help us figure out the target groups to apply those primary, secondary, tertiary prevention labels to. So share those models, and the work, by the way, the public health framework will share, and the frame is from colleagues Stephen Smallbone, Richard Wortley, and Bill Marshall. Richard and Stephen from Australia, Bill Marshall from Canada. So that's the prevention framework that we'll share, and then we want to apply that framework to real situations where the ECSA toolkit has been deployed. And we'll think about the situations, the problems that they were facing there, but also examples of interventions. What did they decide to do about the child sexual abuse problems that they were facing, and what might some of the outcomes have been. And then there'll be the opportunity for, as I've already indicated, for asking questions through the chat function throughout the session, and we'll try and get around to answering them at kind of key moments during the presentation. But we'll also have bigger question and answer sessions right at the end. So that's the kind of the journey we're going to follow. So just a few words about the Lucy Faithfull Foundation. So established in 1992, and it really grew out of a residential treatment program called the Gracewell Clinic and the work of Ray Wire back here in the UK in the late 1980s. Again, a treatment program for a residential treatment program for men the world would call paedophiles. So working with those men who committed sexual offences, working with children who've been affected, working with the families of those people, but also critically work with all the agencies that work across this piece. Police, social workers, probation officers, health workers, other NGOs, government departments, in terms of influencing policy, has been a kind of critical development over the last few years. So yes, our work has kind of spans all these areas, and clearly very recently has kind of morphed fairly significantly into applying our thinking to the issue of online child sexual abuse, issue of viewing sexual images of children online. Some people would refer to that as child pornography, but also sexual grooming of children, and live streaming of sexual abuse from various parts of the world. We do assessment, treatment programs and prevention work against all these populations. And the Stop It Now helpline then, it was set up in 2002. I've already acknowledged that we have sister organisations elsewhere in the world. And I'll say a few words more precisely about who Stop It Now targets, but essentially in our world, it's this is a helpline and key messaging and educating the public about the role the public can play in preventing child sexual abuse. And the Stop It Now helpline is for adults with concerns, and particularly many of those adults are concerned about someone else that they know or they love, or the neighbour, or what a particular circumstance, that someone that's currently in the courts that lives nearby, what they need to do about that. But a bunch of the people contacting Stop It Now helpline are people concerned about themselves, and the risk that they do or might pose, and we offer them support and help to make sure that risk isn't realised, or if it's already happened, that it's not realised again. And the Stop It Now helpline is a confidential helpline, having said which, if people give us identifying information of themselves or of a child at risk, then we professionally have an obligation to pass that information on to appropriate authorities, typically in the UK, law enforcement or our children's services departments. We do some international work, and the ECSA project, I guess, represents the larger part of that international work. So as well as trying to influence policy and practice developments at a global level, we're also working on the ground in a number of countries. Originally, some of those countries were in Eastern Africa, in Eastern Europe, and most recently, again, in South America, precisely in Brazil. But we're not limited to those trajectories. They're just places we've had a particular kind of utility in bringing the ECSA project to them, and to seeing what influence and what support that could bring into their thinking and their planning about sexual abuse prevention. So this Eradicating Child Sexual Abuse, ECSA project. So one of the things that I'm hoping you may have done already, but hopefully you'll do after this session, is you'll visit the ECSA website, and we clearly will have a link to that ECSA website at the end of this session. But frankly, if you do a Google search, ECSA and Lucy Faithfull, as in the Lucy Faithfull Foundation, that will take you to our website. A free website. We're not looking to make money out of this as an organization. We're wanting to share what we find, what we use, what lessons we've learned, and what other people providing services across the globe that we talk to, what they've learned as well. So the whole point of ECSA is a free sharing of information. And it's not just a toolkit of information, but it includes a toolkit. Includes a toolkit of how how to create a child sex abuse prevention strategy. But it's also a methodology provided in that toolkit about developing that strategy in the first place. What are the stages and the steps of strategy development that can be taken? And these aren't just ideas from Donald and Willie and the Lucy Faithfull Foundation. These ideas and this learning has been taken from World Health Organization, WHO, or UNICEF, and other global players as well. So, the putting of a strategy together has been informed and influenced by other global players' work. But the examples in the toolkit, examples of programs or interventions, are essentially they may be very locally developed projects in a country, or they might be countrywide projects. We'll get round to what they are and how you can find them and see them later on in this session. When designing the kind of ECSA toolkit, that we had kind of two particular audiences in mind. And one of those audiences were these people, frontline practitioners. I guess like some of the people in this seminar right now. Because when we'd started off, we were asked by some frontline practitioners in Latvia, over in Kenya and Tanzania when I visited there, frontline workers wanting to know what work could they do with children who'd been abused, for example. What were the components of a credible, useful intervention? Other people were asking, as a probation officer or criminal justice social worker, what kind of programs should I be thinking to do to deliver to convicted sex offenders or to youngsters who are getting into trouble for harmful sexual behavior? But other people, teachers, and people going into schools talking about, well, what lessons do I need to be sharing with children at 5, at 6, at 9, 10, 11? What's the information I need to be sharing with them about keeping themselves safe? Or what's the information I should be sharing with parents about how they keep their children safe from sexual abuse? So we had this bunch of frontline practitioners asking questions about what kind of intervention, in my circumstance, for the audience I have in mind. And that's where we started gathering examples of interventions, not saying this is the right one to use, but just saying this was designed with this audience in mind in this other country. You might find it helpful to see what the content is and decide if that might have some utility where you're practicing and for your audience. So there's those frontline practitioners as one user group for the ECSA website. But the other user group were strategic leads, as people are putting together kind of that thinking behind a strategic plan about preventing child sexual abuse. What kinds of components of prevention do they need to be thinking about? Clearly, spending any staff or volunteer time doing anything has a resource implication. We want strategic leads to be spending resources wisely. We want the evidence and the science behind those decisions to be as well informed as can be. We want those strategic leads to be influenced by the latest data and insights. I think here in the UK, we've seen how strategic developments seem to lurch about depending what's currently in the media public domain. So what the media is shouting about gets attention, and then other aspects of child sex abuse get less attention. Well, strategically, that makes no kind of sense if our priority is how do we keep children safe? Not how do we keep the media happy, but how do we keep children safe? That has to be based on what we know is the problem that we're facing, or what can we find out about the problems that children are facing in terms of risk, and then what can we find out about what interventions will influence or reduce the likelihood of that problem arising, or increasing the thriving if that problem has arisen in the first place. And we're currently, as in March of 2022, currently working with NGOs in Bulgaria and in Brazil, using this methodology and using some of the thinking. And we can kind of speak about those aspects in a wee while. So that's something about the ECSA, and this is just some screenshots about what you can expect to find in the ECSA website. So there are kind of issues about what is child sex abuse, because whatever you're thinking as it's brought you to the LEF conference, So some people don't have a fully formed view about what child sex abuse is or isn't. Certainly lots of members of the public don't have that view. So we needed to at least start with saying, what is child sex abuse that this website is trying to address? And we have content behind that door that is about what it is, the definitions, and the range of different kinds of abuse that might be at play. We have then some thoughts about the steps towards prevention. There are a number of models. We'll share one in a few minutes that is about how does abuse happen, and it's almost like a stepped process towards abuse happening. And this steps towards prevention is about applying similar thinking to what are the steps that will prevent abuse from happening then. And then we locate all of this information into the theoretical kind of understanding of the problem. So people need to understand some aspects of theory and science behind the problem of child sex abuse, or the problems of child sex abuse. What's the theory that supports the thinking that's gone in to putting this content together, including the steps towards prevention. And then we talk about, this is learning how to implement your prevention strategy, having planning meetings, and we have some documentation that people can use to have those planning meetings for beginning to think about prevention. How the strategy might be assembled, how it's developed, what thinking, what information needs to be brought together in order to allow that thinking, that information to influence and inform the structuring of a strategy. And then we have a working tool that plays that stuff through in terms of which different interventions in the ECSA toolkit you might want to think about for the strategy you've got in mind, and how can you explore those further before you implement anything at all. So this is the essence, I guess, of what ECSA is going to be about, but we'll see how that works out in practice in a few minutes' time. We have interventions from across the globe. This is not the most recent screenshot. I'm sorry, I didn't manage to grab the latest one off the website, but just to give you a clue as to where the various interventions that we put together in the website, where they came from. This was about 12 months ago now, and Willie particularly has been working hard to move from what's currently about that was about 12 months ago, 150, 160 interventions, to a place now where we've got more like 220, 230 interventions from various parts of the world. Interventions that are about engaging with children about prevention, engaging with parents and carers about prevention, engaging with perpetrators after they've abused, engaging with children who've been victimized, engaging in organizations to make themselves as safe as possible. So situational prevention, if you will. So interventions from across the globe that have been brought together so that in any country you can find out what somewhere else is doing about a rather similar problem to the one that you or your country or your city or your state has got. And of those 220, 230 interventions, each one then unpacks into a template, a formatted document, just 2, 3, 4 sides with some common content within it, just to give a shape to each intervention, so that each one comes as a standard presentation with links as to how you find out more. These templates aren't designed to make the biggest decisions on, they're designed to help people do some initial thinking and to see what's happening here. And this JIMBA safety program from Latvia has been just a really influential program working in Latvia that involves classroom settings and involves group work between kids and games involving children. And there's a big kind of puppet called JIMBA that engages with children about safety and some key messages. And it's designed, as you can see here, for children aged 5 to 11 years, but also has some engagement and information for parents alongside of that. And it's delivered by an organization, which is an NGO as we are, and the Centre Dardedze that delivers this program. And there's the various bits of information about the mode and context of delivery, but that's not for now. That's just to show you how a template would exist, roughly what it is, who's it's targeting, who's delivering it, the mode and context of delivery, what level of nature and staff expertise is required to deliver this program. Important to know that. What's the intensity of the program? What's the description of the different components of the intervention? And as you can see here, to build children's self-esteem and self-confidence, to enhance a child's ability to avoid victimization, to promote disclosure of abuse and victimization, to reinforce adult supervision and protection, to provide relevant information to adults to enable them talking to children about their safety. So number of different kind of components that are brought together in this one program, and then all those aspects are unpacked below in terms of the items of the program content that you can find out for yourselves. And then we can talk about the evaluation and further references and where you go, the Centre d'Ardedzé, for further information about this program. So that's one example, and there are about 220, 230 examples of interventions that follow that same format, with clearly different components depending on the target audience and the thinking behind the program that was put together. So hopefully that's kind of clarifying some aspects of the ECSA project as to what we've been assembling. Currently, and this is simply acknowledging other organisations that have influenced what we've been doing and have been hopefully benefiting from the ECSA project so far. So Pulse Foundation and the Demetra Association, both in Bulgaria, Pulse Foundation in an area of Bulgaria called Pernik, and Demetra Association over by the Black Sea, in two locations, in Burgas and in Plovdiv. So two existing NGOs that have then been using the ECSA thinking, the website, and some face-to-face engagement with ourselves to influence their development over the last 3 years. And we can reference that in some conversations we'll have later on. And then we've been working with NGOs in Recife in Brazil. So kind of a Recife metropolitan area, part of the state of Pernambuco. Pernambuco having what, 8 million-ish population, Recife having a population of about 3.5, 4 million. So engaging face-to-face with NGOs and state agencies in Recife and the wider Pernambuco region, and using the methodology to inform some information that had been gathering together. So so the Brazil story started at a very different place than the story in Bulgaria, which has a consequence then for how the ECSA project could develop forward. Again, we can come back to that later on. And just so that I can stop thinking for a couple of secs, can I just ask you then to apply some initial thinking, and I'll leave it just a few seconds to think about this. We were working with colleagues in Australia, in Queensland, about a particular aspect of a problem that was sensationalized with newspaper headlines, and it was to do with the Indigenous Aboriginal population, but also Torres Strait Islander population in the state of Queensland, and the Courier Mail clearly wanting to make a drama out of it all, and we were asked to join a team to think about what could be done to address the problem of particularly youth perpetrated child sexual abuse in both rural Queensland, in a couple of communities, but also in the city area. In fact, in West Cairns, which is a kind of big holiday destination for people going to the Great Barrier Reef. There were particular problems that have been identified by professionals, but also by researchers. And I show you these maps because this is a map that represents in the city area where most of the sexual assaults of younger children, typically girls, typically between the age of 8 and 15 years of age. These green areas are typically where these assaults were taking place. and they were mostly being assaulted by older members of their own community, both Aboriginal and Torres Strait members of that community in these areas, typically 3, 4, 5 years older than the female victims, and the perpetrators were almost entirely male perpetrators. So we were asked to kind of explore the possibilities, what could be done to prevent this ongoing problem that had not been addressed for really rather many years, and about which agencies, but also the community itself, was just was feeling anguished, but also feeling kind of that they didn't have solutions that they could bring to bear. And just to give you a clue, I mean, in terms of what drew attention in the first place to this problem in this city area, very high rates of sexual offences. So in fact, this is offences being reported indeed, even though that it was only a small minority of offences that were recognised as being reported. The vast majority were going unreported, according to testimony of the local children. Very high rates of teenage pregnancy, kind of rates significantly elevated above the rest of the state, and equally very high rates of sexually transmitted infections. Again, and these infections are being recognised in teenage girls in particular, but some as young as 8 or 9. The majority of offenders, the convicted or identified offenders, were Indigenous young males, and this is the age range, 13 to 21 years of age. And again, this is the minority of incidents that are being reported, and the majority of victims reporting were 11 to 18 years of age as victims. And again, victims being female, and many victims being from these same Indigenous groups. Range of themes were going on in these communities. There was high levels of public violence, but also family violence. Significant elevated levels of alcohol and substance abuse of all kinds across the community. Rape was a frequent event, according to the testimony of so many people within the community. And as they would refer to it over here, we would not refer to it as this, but there was this notion of girls trading sex. We would refer to that as child sexual exploitation. So a notion of exchange taking place, and for money or for some kind of goods, girls making themselves available. As I say, we would refer to that as child sexual exploitation, and the coercion and influence that is brought to bear at community level, or indeed from individuals to participate in that. So community problems at scale and of significance. Family problems indicated high levels of family violence as well, and with children, a significant loss of respect for parental or adult controls, such that parents largely kind of told us that they couldn't control their children anymore, and their children, whatever their children would do was out of their control, was not their responsibility. And adults, therefore, failing to monitor their children, they'd kind of given up doing that in large part. I'm aware this may sound very pejorative, but this was the feedback from the communities, from the elders, particularly within the Aboriginal community, but also we engaged with the Torres Strait community as well. There were peer concerns about youth gangs, and there was much conflict between youth. Youth sexual behaviour, I mean, a very sexualised culture, with a male sexual entitlement being the norm, that the men, the boys, are entitled to take what they want, what they wanted, essentially. Significant lack of respect for girls and for females more generally, but also the very notion of consent. There was no discussion at community or indeed in education about issues of consent or respect or mutuality. None of those things were discussed across this community. And where abuse had happened, there were significant kind of community barriers to reporting that abuse, but massive fear of the police and a hostility towards the police, typically because of the kind of very different kind of ethnic, kind of racial backgrounds between the community, strong ethnic minority population, but also the policing of that community tend to be typically white Caucasian police officers. But also a culture of victim blaming. If the girls didn't want it to happen, they wouldn't have been there, or they shouldn't have dressed like that. So those kind of attitudes around. So having gone through some of those speeches, this was a condensed version of a significant report that went off to the politicians. And these issues arise within the green areas on this map, where the streets don't go through. So there's no traffic going through these green areas. These are called the backtracks. They're more scrubland, and this is a drain, not a river. So it's a bit of a kind of an inhospitable place with scrub, place that youth gather, and essentially during the evening time and night time, it's a no-go area for adults, including police patrols don't go here. And including ambulances don't visit here because of the danger for the staff in those ambulances if they choose to. So fairly hostile for adults and for adult supervision, and children behaving very badly. And there was even some time sequencing done so we could see when were the worst times for this to happen. And we saw that it was Thursday and Friday nights in particular, and big party times that were going on when a lot of this abuse was happening. So just thinking about this place and the issues that I've just raised with you, I'll time it just for 15-20 seconds, just give you some time to think about what would you do if you to bring this problem under control, to reduce the level of sexual abuse of these girls in particular between the age of kind of 9, 10, 11 through to 18. What would you do to reduce that incidence, to reduce the likelihood of the boys behaving so badly, which typically is what's going on? So just 30 seconds, 10, 12, 30 seconds to just think that through. Jot 1 or 2 ideas down if you can, and we'll come back to you later on. This isn't for straight away. This is we'll be visiting this issue in a wee while. Okay. So we'll come back to that in a while. Let's go back to kind of the starting place of some of these things in terms of what do we know about the scale of child sexual abuse itself. And these are kind of global figures, and that wherever you're variously from, you may have some insights from your nation as to what's understood about the scale of the problem where you are. But essentially, when people looked at the kind of the global prevalence of child sexual abuse, then something like 11.8% of the world's children were recognized as having been sexually abused during childhood. Typically not simply a single time, but on multiple times. And if that's a global figure for children, then Pareda and colleagues looked at that. That's brought some studies together from 22 countries, and found that 18% of girls and 7.6% of boys had experienced child sexual abuse, or that was their testimony. So it's a problem at significant scale, well over 1 in 10, and tends to be a preponderance of girls rather than boys. And what we know going forward is whether there have been studies done at a national level or not. The Economist Intelligence Unit is due to undertake further global prevalence studies across 52 countries in 2021-2022 to give us a snapshot of and what's it like now. I would just tell you here in the UK, the understanding would be somewhere between 1 in 6 and 1 in 10 of all children have experienced sexual abuse, and I'll say something more about the context for that. But mostly, albeit it's not the strongest show in terms of media exposure, most of that abuse is still taking place within the family environment. Typically not mum or dad, typically a male relative, an older brother, or a male visitor to the household. So significant kind of levels of abuse, and in the UK, as I say, that we've had some recent insights from that. In terms of kind of what we also would recognise, and this is certainly from the UK, only around 1 in 8 of all cases of child sexual abuse are reported to the police or social work at the time. And why that's important is that if a problem at this significant scale is happening, and very little of it is getting into any kind of policing or social work system to bring some kind of remedy, then what is the answer? What's the salvation for children? And it was our Children's Commissioner back in 2015, after the UK had invested heavily over many years in increasing its criminal justice response, increasing its sanctions, increasing the social work with kind of parallel actions to that in working with victims and with families. We still had only around 1 in 8 cases of child sex abuse being reported. And why was it not being reported? Typical reasons: no one to turn to, or the absence of someone else to trust, or perpetrator tactics, including the child's fears and anxieties that are being manipulated by the perpetrator. There may be developmental barriers. Clearly, some children just don't have the words for what's happened to them, and some children are being abused at very young ages when we wouldn't expect them to have the words. So range of different components that contribute towards that. Emotional barriers. The children might think they're to blame, and certainly perpetrators will in many circumstances allow them to think or encourage them to think they're to blame. Or if they hadn't asked that question, this wouldn't have happened.
Donald, we've got a question from Natalia. I wonder if this might be an opportune moment for her to ask the question.
Okay. Yeah, Natalia, do you want to come unmute and ask the question?
You're still muted, Natalia.
Hello, I can hear you just then.
Thank you so much. I have a question. I wanted to ask what organizational or institutional reforms we can conduct in some countries to improve this reporting. I mean, I'm from Colombia and I live in Mexico, and here the organization that are the recipes that receive these reports are not prepared for this. So what kind of organizational reforms can be conducted to change this or to help improve the underreporting? Thank you.
Okay. Okay, that's a question that has every consequence for whichever context we're talking about, and I think it's a question that I think in each nation we ought to be asking, and that's the question that the Children's Commissioner in England was asking. Why do we get so few reports, and what changes need to be made? And I think a useful place to think about, I mean, UNICEF and the World Health Organization, and if you go on the ECSA website, you'll see some fundamental documentation from them that helped us to begin by asking some of those kinds of questions. And there's a very kind of active current piece of work going on now. We call the We Protect Global Alliance, and at the end of the session, if there's more aspects that you'd like to unpick from your question that haven't been resolved in this seminar, then do drop Willie or myself a line, and we can start thinking about that with you. Can I just say that when Willie and I, and you've gathered our backgrounds, went to Recife, in Brazil, then we learned that there was lots of national discussions and documentation, but on the ground in Recife, this was making no difference to the children's lives at all. And the police were very poorly resourced. The children's services were largely unsighted on the problem. The NGOs the non-government organizations weren't collaborating well between themselves to influence what happened. So our job was to offer a model and to bring those people together to decide where can we collaborate that improve recognition of the problem in the first place, that improve reporting rates in the second place, but essentially what are the components that would prevent this happening at all. And we have to hang on to a notion that child sexual abuse is preventable, because we can put all our money in response and never have anything left to prevent. And all we'll ever do is respond to a small fraction. That's why I guess our project, Eradicating Child Sexual Abuse, is about keeping a strong focus on prevention alongside the developments in the response, in the recognition, in the criminal justice mechanisms alongside of that. But hopefully your question's good, and maybe you could ask it again in the discussion right at the end, as well as other questions that might arise with you as we go through this presentation. So thanks for raising it. Okay, so this is then just finally, why such massive underreporting? Get to the last two. Others were not recognizing the signs or indicators of abuse. What can we do? So why is there such an underreporting? It seemed to be, if others aren't, other caregivers or parents weren't recognizing signs and indicators, then it was left to the child to be the person to report. And often the child is in a distressed place, or has no words, or is feeling ashamed, or has been manipulated in such a way they can't open their mouth about what happened. But others are ignorant and are doing nothing. But for the child also, a fear of consequences of telling. If a child is abused by someone that they love and they care for, but the abuse is happening, then they might be fearful that this person will be taken away from them if they tell, and that life would massively change. So there are lots of barriers to children telling, essentially, and we need to identify what they are and hopefully overcome them over time, which will involve a number of strategies that I think ECSA hopefully has some answers to. So if that says something about the nature of the problem, the scale, and some of the barriers that we were identifying in the UK, can I just then go to another model briefly to unpick this? This is a model to say something about how abuse happens, a model from the 1980s, that the importance of the model is not just the how it happens, but also who's involved in this process, because that gives us a clue as to who needs to be involved in prevention then. And this model is from an eminent researcher called David Finkelhor from University of New Hampshire. And in 1984, this was new theory and research. And it's been used to inform thinking about child sexual abuse across the globe ever since then. And it's a model that still is extremely valuable in telling the story to not only professionals, but also to members of the public, to parents and carers, to teachers, etc. And essentially, the model was called 4 preconditions of child sexual abuse, because there are 4 components or 4 stages that the model considers. And this is portrayed here as a journey with a beginning and an end. And this journey starts by saying child sexual abuse starts by the development of a motivation within the perpetrator to cause sexual harm to a child. And the development of that motivation may, for a perpetrator, develop in their adolescent years, and for many that will be the case. But that motivation might develop in later adult years. And what we're seeing currently with the availability of the internet and child abuse material, or child pornography, people might say, on the internet, that may be one component right now that's helping develop that motivation in older adults. So there's a motivation develops that involves some kind of sexual interaction with a child, but this is just in the thinking of the person. This isn't doing anything yet. But doing it will have happened by the time we finish this journey. So the offender develops a motivation. In order to then take that motivation, kind of to follow that down the track, the offender has to overcome his, and most offenders are male, although that will vary in 1 or 2 nations, but globally the view would be child sexual abuse is committed predominantly by males. That they have to overcome their conscience in order to do what they're thinking to do. They have to make it seem all right. They have to justify their behaviors or their thoughts to themselves. They have to make it seem like it won't be harmful, or that they deserve it. So all manner of excuses they might give themselves as to why they want to act on what they're thinking about. And that's important, that many offenders have a conscience, and that gradually over time that conscience will be muted in some way, and we have to figure out ways of elevating or increasing that conscience so they don't do what they might be thinking about. Anyway, so this person's motivated, they're engaging with their conscience to make it seem okay to themselves to do what they want to do, but they then have to manipulate other people. And in the model, David Finkel used this terminology, he's a psychologist, external inhibitors, other people who would have prevented the harm happening. So for an offender to offend within a family, they have to somehow make sure that the mother of the child typically doesn't get to see what's going on, or the mother of the child is so bullied with domestic violence that she can't see what's going on. If someone is wishing to abuse a child within a school setting, then the offender has to make sure other people, the external inhibitors, are kept away, are without sight of what is taking place. So somehow the offender has to think about how to make sure what they do isn't observed by other people who would interfere or would stop it from happening, or indeed might report it. And then fourth and finally, the offender has to overcome the resistance of their victim, the child that they have in mind. They have to manipulate that child so that they don't speak, or they can't speak, or they feel that it's their fault or their responsibility, or they feel it's what they want. This may be through gifts, this may be through an emotional attachment, and getting the child to be curious about sexual matters. But ultimately, it's about the perpetrator doing with the victim what they want to do and getting away with doing it. They don't want to be reported on by the child. And as I've already indicated, most child sex abuse is not reported. So as a basic model to understand the behavior, and this is a model that's used in sex offender treatment programs across the globe to understand the steps that perpetrators went through, this already starts to help us to think about, well, what can we do to increase the conscience of perpetrators so they don't do what they're thinking to do? How do we stop the development of motivation in the first place? How do we encourage communities to be very clear about the harm that sexual abuse does so that people don't develop a motivation but think it will be okay? How do we give other adults, parents in families, or teachers in a school, or members of the public in public places, how do we give other adults the insights, the information, so that they would recognize abuse for what it is, and they would intervene or report or do something that means the abuse can't take place or can't take place again? But also, how do we help children be safer? How do we help them recognize their rights to not be sexually assaulted, recognize their rights to not be touched where they don't want to be touched, recognize what will be wrong about that, and how do we help children to know that there are adults you can trust, that you can go to when something's gone wrong or you're worrying about something? So how do we help those children be stronger, know more about their rights, their entitlements, but also have a voice if something bad has happened to them? So just a notion of some aspects of prevention that we can build around these things. And these are all parts of the prevention framework shortly. But there's another model just to bring to the table. If that was the model from child sex abuse, there is a model of crime from Paul Eck that helps us understand a little more about another aspect. And this is not to do with child sex abuse per se, it's about any crime problem, but we're going to apply it to the crime problem of child sexual abuse. And the crime triangle simply says this: for any crime to exist and to happen, you need to have a willing offender, you need to have a vulnerable victim, and the crime has to take place in a place. So these are the three essential components for a crime to happen. And if you remove any of these components, you've removed the possibility of the crime. If you remove the place where it happens, then it can't happen there. If you remove the possibility of a victim being vulnerable, then the crime against them won't happen. If you remove the willing offender, there is no crime to happen. So this gives us a clue about some components of a prevention framework. But he took this model a little bit further and then brought into it other people that have a role to play. And that even if the three components, the willing offender, the vulnerable victim, and the place exist as in the components that they originally did, then what can we do to bring in other people that can stop the crime from happening? So crime handlers or are people who can control the offender so that he doesn't do what he's thinking to do. So is this a parent that knows the risk that their son or daughter represents, so that their parent influences them so they don't become the criminal they don't want them to become? Or is it the guardians of children who may become victims, so the guardians take care so their children aren't exposed to the risk or aren't made vulnerable to the risk? And in the places, and we can think about parks, or we can think about schools, or we can think about the place of the internet, online spaces, then what about place managers? If people's role in those places is to restrict opportunities for the crime to take place. Limit opportunities, increase the risk of getting caught, whole range of strategies that can take place at the hands of place managers to make sure that opportunities are reduced and crime doesn't happen. So these are just components that are brought together in the framework in a second. So we got from the Finkelhor, we've got the perpetrator himself or herself, we've got the external inhibitors or the other parents, and we've got the children. And from here we have the places or the place managers to think about. So what does situational prevention look like in practice? So I'm going to hand over to Willie now to apply some of that thinking to the framework that we want to bring, that we'll then take back to the place that I invited you to think about before, this place called West Cairns, with the indigenous communities and the sexual harm happening in large quantities in those places. Willie, handing over to you now, I think, and I'll forward your slides when you want me to.
Thanks very much. Yeah, I'm conscious we've got a little over 20 minutes left, so I'll go through this reasonably quickly, as there's another presentation starting on this channel bang on the time that we finish. However, yeah, child sexual abuse as a public health issue, there's many aspects of violence, of which child sexual abuse is one aspect, which is certainly a public health issue. And crime prevention, as described by Donald, is not a new concept, although it's been looked at in different ways over the years. I do remember as a young police officer, any crime prevention to prevent child sexual abuse was aimed firmly at children. And as a young officer, we had to learn a song called Never Go With Strangers, and sadly go into primary schools and sing it to the children, which must have been disturbing in itself to the kids, but if I heard me sing. But however, so looking at it as a public health issue, approaching child sexual abuse from a public health perspective firmly places it into three distinct areas. And you can think about this from a health preventative model in relation to heart disease. If you were tackling the health issue of heart disease, a primary prevention model would be before it's happened. So it's general health messaging for the general public, not to smoke, take exercise, eat healthily, that kind of thing. Secondary prevention would be aimed at people who are of a higher risk of suffering a heart problem. So those with weight issues, diabetes, heavy smokers, and so on. And then if somebody actually has had a heart attack or some significant heart problem, tertiary prevention activity could be surgery or medication, and so on. So looking at child sexual abuse in this way works in a very similar way. Primary prevention can be aimed at the general public, or it could be aimed at people who haven't offended yet but have the potential to do so, verging into the secondary prevention. On higher risk people, for example, we know that children with disabilities are at a much higher risk of being subject to child sexual abuse. Certain places and activities tend to increase the risk, and there might be a secondary prevention aspect to that. And tertiary prevention, preventing recidivism. So if it's happened already, how do we work with the victims or survivors of such abuse to make sure it doesn't happen to them again, because again, they have a raised risk. And also those who have offended, how do we prevent them from offending again and repeating that victimization? So thinking about the three models, three levels, can we move on to the next slide, please, Donald?
We can.
Good, good.
Okay.
Oh, okay. Thinking about approaching prevention from a primary, secondary, and tertiary viewpoint, Stephen Smallbone was mentioned earlier by Donald. He came up with others, a comprehensive framework for prevention of child sexual abuse, which is available in it. It talks about a framework for prevention. So across the top, you can see the primary, secondary, and tertiary prevention models that I've described. But down the left-hand side, there's more than just the three areas that Eck described in his model. We have offenders and potential offenders, victims who in this case will be children, families and communities, and also situations and places. So the idea with this is, if you're starting to develop a strategy for prevention, you can think about what exists to prevent child sexual abuse in each of these areas. And we'll move on to the next slide and look at how that might work. So that framework that I've just shown you, if we were to have treatment programs for convicted sex offenders, so those who have already been convicted of sexual offences and we don't want them to offend again, those interventions, those treatment programs, I would suggest it's fairly obvious in this particular case. This would be a tertiary prevention activity, and those sex offender treatment programs would go on the offenders list with offenders that we're treating. And the kinds of things we're talking about are prison programs, talking about multi-agency public protection arrangements, sex offender registration, all sorts of things like that. However, at the start of this, I talked about prevention being aimed fairly and squarely at children. That doesn't work on its own, and neither would just dealing with offenders, particularly with Donald describing that the vast majority of these offences never come to the notice of the authorities in any case, probably less than 10%. So we really need to be looking at all aspects of prevention, not just those that we know about through recorded crime. Okay, the next thing I would like you to consider would be where we would put on the framework awareness raising prevention education programs for all parents and carers. This is absolutely vital prevention work. It's clearly the responsibility of adults in the main to protect children from harm. And the kinds of prevention activities I'm talking about, there's one from the USA here, Darkness to Light, which provides information for parents and carers to pass on to children. There's also a similar one in the UK called Parents Protect, which is run by ourselves, and other similar ones. You can find out details of all these on the ECSA website. All these interventions are listed in some detail in there. So those kind of interventions, clearly they're aimed at families and communities, and they would go in the primary prevention, perhaps leaning into secondary sometimes, but Darkness to Light and Parents Protect clearly fit into families and communities. The next thing I'd like you to have a look at and consider would be primary school programs for personal safety and sex education for all 10-year-olds. Again, that's aimed at children. So on the framework, you can have a look at the framework again, Donald, if you just pass it on to the next one, and consider something like Porcupini that was mentioned there, the Hedgehogs program, as it's known as in the UK. That's widely used in various parts of Europe. That is aimed at children, so it goes in victims and children box, primary prevention, and that would be added. And the one I want to quickly mention would be the next slide, Donald. Online safety education for children with learning difficulties. I mentioned that children with learning difficulties and disability in general increases the risk of those children suffering child sexual abuse. So an example of that is in the next slide. This is something that we developed with the Health Service in Scotland and also Fife Adult Support and Protection Committees to develop specific interventions for children and young people with learning difficulties, taking into account the style of the information and how it has to be certain colours and font sizes. So this was specifically aimed at that particular group, and on the framework, which would be on the next slide, that would clearly fit into victims being children and secondary prevention because they are a higher risk group. So moving into the next slide, which I think is we'll just probably skip that one, Donald, if that's all right, and just go into this next one. Now that talks about mentions all the different interventions that I've talked about. So if you're looking at what's available in your area in terms of interventions across all the different areas in this grid, you can see what's already being applied, but you can see gaps appearing as well, so there could be a situation here where the response to potential child sexual abuse isn't covered right across the board. So I'm not saying for a moment that you can take these and just drop them into your local area or community and expect them to work. If you read through the information available on the ECSA website, we have a lot of information about considerations of context. And if you were in an area where perhaps there was no information for families in form of primary prevention, you may be able to look around on the ECSA website, look at other interventions and see something which might be similar to something that you would look for, but there's lots of considerations about political, religious, legal contexts which have to be thought about before you could achieve success with an intervention brought in from somewhere else. Somebody's also brought up the cultural and socio-economic conditions as well. It's absolutely right. So lots to be considered before you can drop things in. But there are things happening across the world. Donald mentioned the 220 plus interventions that are on the website already. And it's amazing that we keep on reinventing the wheel when other people may have the answers already for you. So these ideas can be used in conjunction with the development of your strategy using the information on the ECSA website. Do you want me to continue this, Donald? Or...
Please do.
Okay, so the interventions, we've gathered them from all over the world. They're listed on the website. They're very searchable, so you can search by whether they're using the similar kind of search terms from the grid. So if they're primary, secondary, or tertiary, or they're aimed at children between certain ages or locations, or whatever they might be. So you can search through them quite readily. You can also search through them in relation to the languages that they're available in. Many of them are already available in a vast number of languages. The website itself is in English, but it does have a Google search function attached to it so that you can translate the main sections of the website to the language that suits yourself. And on each intervention, we have evaluative information wherever it's available. But this isn't all highbrow academic stuff. It ranges from very, very complex interventions for high-risk sex offenders to children's books, the preventative information that you can read to children. There are puppet shows, but if you consider in some parts of the world, puppet theatre is a very powerful communication medium, so it should never be discounted, and everything in between. So it's actually a fascinating read on its own to have a browse through the kinds of things that are being delivered globally. But the main thrust of the website is taking you through the stages that Donald's already described to develop a strategy using the information that we've provided for you. The toolkit is there. Again, Donald's already gone through this, but this takes you through how to develop your own prevention strategy, but it has to be considered in the context of your own environment. There is a risk with organizations traveling to other parts of the world that it can be seen as some kind of colonial intervention. It's never the intention to be like that. This information and advice allows people to develop things within their own context using what's already available, because there are people across the world working hard in this area, but there can be help provided through using the ECSA website and following the stages that are here. There's further sections which are not mentioned on the slide, specifically talking about evaluation and how to measure what works, because measuring prevention can be challenging. How do you measure something that hasn't happened? But you can measure the effectiveness of what you do in relation to interventions. So, and the paper in relation to evaluation will take you through that. And again, a specific paper on context and how to make sure that whatever it is that you're doing is being developed within a context which is appropriate to yourself. Next slide, please, Donald. Okay, so this is going to take you back now to, Donald gave you a taster earlier of Australia. We've got about 10 minutes left, Donald, so I'll pass it back over to you.
Yeah, I'm slightly puzzled by your timing, Willie, because I thought we had an hour and 50 minutes, not an hour and 20. Anyway, so I spoke to you about the backtracks and where the youth perpetrated sexual violence is going on at the moment in West Cairns, and gave you some insights about the nature of the local problems that were arising in this place. Willie's just run through then the prevention framework itself and some of the thinking, primary, secondary, tertiary, and the different targets for interventions. So I think we don't have kind of the facility of breakout rooms, unfortunately. So I can't encourage discussion between groups of delegates. But what I would invite then is for people to put their hand up to suggest one, maximum of two things that you think could be offered in this place. This is West Cairns in Queensland, to reduce the nature and the scale of this problem. So what kind of things would you think could be done to make an impact on this youth perpetrated sexual violence in this place? Now you have a choice. You can either unmute and speak to us, or you can send a couple of thoughts in the chat service below, and send your views that way. So we'll just spend the next kind of 2 or 3 minutes exploring the possibilities that you would think about that we could bring to this place. Any instant offers to speak up? In which case, let's kind of make sure you're unmuted and speak. Otherwise, we'll look at the chat.
Don't be shy.
Hello.
There's a message from Kim, directing education to all the stakeholders, children, offenders, police, parents, regarding the problem. It's education to all stakeholders.
Okay. Okay, so there's quite a raft of stakeholders involved there, and I think there's another one just coming as well. Can you read that out, Willie?
That was just the start. That's from Kim as well. Basically, a start would be directing education to all the stakeholders. Anybody else for messages?
Or anyone want to speak and tell us about what they would think to do?
If anyone wants to speak, just have them raise their hand, and I have to unmute them.
Okay, thank you. So no offers to speak, no more contributions from anyone else in the chat, no? Okay. Well, I can then present some of the ideas. Oh, there's another chat just coming in, I think, Willie?
Yeah, yep, that's based on the maps. There should also be some CPTED environmental design implementations, which is a good point.
Okay, thank you. So that terminology, child protection by environmental design, and a very pertinent concept to bring to this very particular place, and certainly I can share that members of the team did illuminate how that SEPTED kind of thinking could influence what happened in this place. So thank you. So we got education to all stakeholders. We've got introducing kind of a SEPTED thinking and response to the place of where the abuse was taking place. Any more before I illuminate what actually has been happening to the present day? Okay, so we've discussed the ideas, we've had some feedback. And this is what happened, and this very much relates to the kind of the SEPTED idea. What was agreed as the plan was to introduce improved and targeted police patrols. So into the places, these public places where abuse was happening, to make sure that there was a police presence, but also at a rhythm. So there was a regularity to that police presence, and police on foot, because there's clearly no means of police driving through this area. So police on foot, but also police alongside of community members, so that the police were there representing the interest of the local community elders, wanting to be in this place together to make sure children weren't hurting each other or being hurt. The notion of designing out youth sexual violence, so kind of SEPTED kind of specific aspects. Actually, we brought in some plantings that make thorn bushes, a water sprinkling system to introduce some kind of some wet areas, introduce some lighting, some street lighting, and CCTVs, so that essentially making it an inhospitable place in which these behaviours, these sexually abusive behaviours, could take place. And that was alongside, though, of creating opportunities for the youth who clearly want to be in places and socialising. How do we create positive places for youth to go and hang out with each other without doing these harmful things? So ideally under the gaze of adults within the community. But also we needed to, if we didn't want to just drive children potentially back to their homes, where abuse could also be taking place. We know some of the children were very clear that home wasn't safe either. So we introduced then some rule setting within the community, which I guess gets back to the education to all stakeholders. But it was, as well as telling them about the nature of the problem, it was also getting the community behind the solution about agreeing some basic rules together, so that it was possible for parents to be the eyes of each other, and with permission to intervene if a problem was seen to be going on, and where parents felt that they didn't have ability to control their children or influence their children's behaviour, to give some education to those parents about how they might improve their parenting skills and their relationship with their children. But also kind of the third component, introducing safer youth networks. Introduced a kind of sex ethics and guardianship program for youth, so that the issues of respect and consent and safety were brought to a discussion with the youth themselves, boys and girls, learning about some alternative ways of being together, and about respectful relationships, and about how to respond when things weren't going as they might wish to go, so that therefore not only engaging with adults about these matters, but engaging with young people themselves, and taking those ethics and guardianship programs not only into the youth networks, but also into the schools, and help children learn at a younger age. One of the things we found out, which was slightly shocking, was that boys at 7, 8, 9 were going in as observers of what happened in these places, to anticipate what they could themselves be doing in 2, 3, 4 years' time. So how to help influence the development of the thinking of those younger boys, so that, again, a notion of respectful relationships and mutuality and issues around consent were fully discussed across the youth, but also with parents. But of course, there had been significant amount of sexual violence already taking place. So introducing therapeutic interventions for those who've been sexually harmed in these places, typically girls, introducing those interventions again through Indigenous youth work, so that we're helping not only to the recovery of those children, but also preventing their re-victimization, so that the work is about recovery, but also about steps that prevent their re-victimization. So and what that meant in practice: police pulse patrols, community night patrols, sexual ethics programs in schools, community youth support, situational prevention using SEPTED ideas in these backtracks, and then a community dialogue elders and parents and community rule setting. So a raft of things, just all coordinated by this single project to bring this thinking together. And it was not that any one thing seemed to make a difference. It was in combination they seemed to make a difference. And these have been problems that have arisen for many years, and we weren't going to change the world overnight, but over a period of 5-10 years of implementation, with the commitment of all the agencies, that the hope is that these will make a material difference to the well-being of children and the good behaviour of the boys in particular.
Donald, can I just jump in for a very second? Just there's a slight confusion with the timing. I got a strange message. Are we still got about 10 minutes to go, Joe?
Yes, we have about 10 minutes remaining.
That's perfect. Thanks very much. Sorry, Donald.
Thank you very much. Thank you. Okay. So that was what was introduced, and this is how we then present those into the framework that Willie's already shared with you. And if you contact us or the organisers, this presentation can be as available to you as it is to us. I don't propose to go through all these components, but it was about school programmes, both to help protect potential victims, so we're just children, but also to dislodge or the potential offenders who are attending those self-same programmes. Community rule setting, parent education, treatment programs for victims, police patrols, and designing out sexual violence in the places where the abuse is happening, and community night patrols working in collaboratively with the police patrols. So again, a framework of actions coordinated together over a project that was called the Neighbourhood Project, that is being written about now over in Queensland, Australia, and the journey they've made and some of the impacts that they're seeing already in the reduced incidence of violence to children. Can I take you to another problem that's not in a particular place? In fact, the problem that I want to then share with you in the last few minutes is a problem to a nation. And the problem that I think we'll all share, wherever we're from, is the problem of concern about the regular users of sexual images of under 18s, say called child pornography. Across the globe, this problem is exploding. Number of people viewing sexual images of children. In the UK, the National Crime Agency reckons at least 100,000 people are doing this at any one time. Just to give you a clue, UK police are putting lots and lots of resource against this problem, and we're arresting now about 10,000 people a year for this problem, which I think is as many, if not more, than just about any country across the globe. But 10,000 a year is against the problem that's at least 100,000 strong. So clearly arresting people and putting before the courts it can only be part of the solution. So the police then, in discussion with our Department of Internal Affairs or the Home Office, they then posed the question, what can we do to deter indecent images of children, child pornography offenders? What can be done about them? There was a number of things that resulted from that, and ultimately they brought themselves together in a thing called the Indecent Images of Children IOC Deterrence Campaign. And I just like you to think about, if with a problem of this scale, then one solution was about how do we get messages to the 100,000 people doing it, and what would those messages say? So if that's a problem I'd like to bring to you as a delegate at this conference, how do you stop people viewing sexual images of children? How do you stop them viewing child pornography? What message do you want to send them today to get them to stop? And number two, where would you put that message? So I'd just be glad people didn't speak up before, so maybe again in chat you could just type one or two thoughts about what the message is or where you'd put it. Where would you serve that message? Just give you kind of 60 seconds to think about that. A message to deter the viewing of child pornography wherever you are in the world. What's the message? Well, how do you get people to stop? And where do you put that message? So there's two components. So if you could maybe jot one or two ideas down and send them in the chat, that will be great. and I'll tell you one or two things that we've been doing against this problem over the last 3 or 4 years. Any thoughts from anybody? I can't see anything coming through yet. Oh, that's something.
Yep. From Kim, main message would be that images, they are real children from their communities actually being abused, and they're contributing by watching and downloading.
Okay, so these are real children, and the watcher is contributing to their abuse. Okay, thank you very much. And any other thoughts from that same person or from anybody else? What other messages could we send to people viewing sexual images of children today to get them to stop? Ten more seconds for any further ideas, and then I'll move us on. No more come through. Okay. Okay, so the camp, oh, we have got one. Before I move on then, Willie, what was this one say?
Images that show the harmful consequences for the children's future lives.
Okay.
Thanks, Natalia.
Thank you. Okay, so we've got this idea that these are real children, and as Natalia just offered, these images will have harmful consequences. The image themselves, but the abuse they typically suffered when the image was taken, that will have harmful consequences for that child, for their future, and that the viewer is contributing to the abuse. So look, some really kind of valuable messages. Thank you for offering those up. This was a collaboration in terms of thinking about the problem and the solution to the problem between all these people. And it was a partnership between collaboration, and that's one thing that the ECSA Project is about. It's about who do we need to collaborate with to tackle the problem at significant scale. And just to say that, I mean, the Stop It Now helpline I've mentioned already was one of the collaborators who targeted people concerned about themselves, adult abusers and potential abusers, but it also targets families and friends with messages about abuse. Don't ignore it, do something, but also parents and carers of young people with worrying sexual behaviour. So those are typically the groups that Stop It Now will be targeting. 49%, 52% of all the people contacting are people concerned about themselves. And we're talking about 12,500 contacts last year from the UK. And the helpline's job is a child protection job, but it's educating, informing, advising, guiding, supporting, encouraging the caller who is confidential to do something different that will keep a child safe or make sure a child is safe. And this is just the trajectory of calls so far that we've taken. And who's been calling in the most part in recent years? This blue band, this blue bar, are people concerned about their own sexual thoughts. Indeed, these are people who have offended on the internet, as you see to the right here. These people have offended on the internet and are contacting the Stop It Now helpline because of that, and because of key messages that got through to them. And we've been developing these messages since 2014, 2015. And we've also developed alongside those messages a self-help website called Stop It Now, Get Help, so that people have access to a treatment program online that has no consequences apart from it helps you to stop and to stay stopped if you've been viewing sexual images of children. It's also a website for partners and for parents of people who are viewing those images online. So it has information for partners and parents and professionals as well. But primarily it's a self-help website for online offenders. So what did we do? Well, we worked with offenders to work out what the key messages were that they needed to hear. And they needed to hear that it causes harm. So what you've been talking about, these are real children being really harmed. It will have consequences for their lifetime, and that you, by watching them, are contributing to that harm. So to be clear to the viewers that it causes harm. To be clear to the viewers that it's a crime, because when we did some public surveys, we found out lots of the public didn't know that this was a crime. Viewing sexual images of under 18s was a crime. But then more than that, that there are severe consequences for you, the viewer, in watching these films, in having access to this material, photographs or videos online. There are severe consequences as and when you get caught. And also we needed to tell them that the police are scaling up their arresting activity, which is the case in the UK, and there are severe consequences, including loss of job, including loss of family potentially, including potentially loss of freedom. You go to prison for this behavior, end up on the sex offender register. So all sorts of consequences that in the moment of viewing them, many of these offenders weren't thinking about, but we had to deliver messages about consequences. But we also, what they told us, you need to tell us, so this was focus group of arrested online offenders, you need to tell us that help's available to stop, because we need help. We're not going to be able to stop on our own. So we developed those key messages back then in 2015, and then we're serving them in lots of places. Google helped us serve them to people making dubious Google searches. Facebook is serving them to people making dubious requests on Facebook accounts. So Google, Facebook, number of other environments, but getting messages out also to the general public through newsprint, through putting posters in urinals in all our service stations across the UK, posters that put up in public places, and our health service putting up posters in hospitals for people who go to hospitals, serving messages on Twitter, doing some advertising on a range of different social media outlets, getting big celebrities. This is a rugby star celebrity here in the UK to support the messages, and getting the police as a major partner to be alongside of us in serving those messages as well. So lots of media, lots of social media, but with the same messages, messages being that it causes harm, it's a crime, there are severe consequences, there is help to stop. And we've been doing that then for the last 6 years. This is the kind of this is how we've done to date. The consequence is 29,000 clicks through from Google and from Internet Watch Foundation. So we've got Google warning pages that serve messages through. We have warning pages served by the Internet Watch Foundation, our hotline in the UK. And some of those searches have come also through from our NHS settings, people seeing posters in NHS settings. Universities across the country been using our posters. What do you call someone who looks at sexual images of children? And there's a range of possibilities. We're student, friend, isolated, me. Anonymous and confidential help is available to anyone concerned about their own online behavior or that of someone else. So just a magnified project with lots of outlets across the country over the last 6 years. And that's resulted in these volumes of people visiting the self-help website. Our helpline, the Stop It Now helpline, has seen a 25% increase in calls to the helpline. The website has seen vast increases in numbers visiting the Stop It Now, the Get Help website. This tells you 500,000 visits or sessions from the UK in 2019-2020. So we're getting through to people at scale, and people are visiting at scale and dwelling in those places at scale. And the most recent development, and this is kind of fuzzed out, because we heard from a lot of arrested online offenders that they had started viewing child abuse material, or child pornography they would call it, having had a previous heavy use of adult pornography. We then discussed with Pornhub the possibility of serving warning messages on Pornhub. So if people are on Pornhub and put in a search on a pornography site for young images, or for images of 5-year-olds or whatever, then we want them to get a warning. 6 months ago, they got no warning. They just got a response that said no results are found when you search for young teen. Whereas February 2021, then we've got some new warnings against the same searches. Warning, your search could be for illegal and abusive sexual material where children have suffered harm. Do not cross the line from legal adult pornography to illegal images. If you're worried about your sexual thoughts of under 18s, free, confidential, anonymous help is available from Stop It Now on 0808 1900, or visit Stop It Now, get help. And Pornhub are saying, we take abuse and violations of our terms of service seriously. To find out more, visit our Trust and Safety Centre. So messages on Pornhub that have resulted since February of this year. 359 clicks through to the Get Help website from people in the UK from this Pornhub warning alone. The Pornhub warning is served globally, so worldwide visits have been 14,000, over 14,000 visits from users of Pornhub worldwide to the Stop It Now, Get Help website, from people who are making very blatant searches for child abuse material in that Pornhub environment. And what do we hear then from users? I believe it's all having a huge effect. As I am now finally admitting this is a serious problem, I need help to deal with it, and I want help. Someone saying, shame there wasn't a bit more advertising for it before. I could have stopped earlier. I wanted help for a year, but was too frightened to ask. So we're starting to get some feedback from people who are learning to stop viewing sexual images of children. And this gives us some view about what we've been achieving over the last 12 months or so. So that's an alternative strategy of way of looking at it. So rather than a problem in one place, this is a problem for a nation tackling child sexual abuse material, a problem at scale that is being addressed at scale by a key partnership between police, NGOs, the internet industry. We couldn't do this without Pornhub helping. We couldn't do this without Google helping. We couldn't do this without Facebook, which doesn't mean I'm a fan of any of those environments. It just means they need to be part of the solution, because that's where the problems are rising in their platforms on their environments. Gosh, so this is us running out of time now. Joe, I'm not quite sure what time we've got left, but that was just an attempt to just cover off what the ECSA project's about thinking about the Queensland project as one way of solving the problem, looking at the issue of child pornography as another way of tackling the problem, and looking at the solutions based on what the ECSA toolkit has available to you, those 220 plus solutions that Willie has referred to already. Hopefully that gives you a clue about the ECSA project and about our work so far. And happy to take any more questions or any additional comments before we seemingly need to close down. But are there any comments or questions from people as we're still live right now?
Don, we have about a minute left.
Thank you very much, Joe. These are our contact details should you want to follow us up with either of us directly. So that's myself and that's Willie, and this is the ECSA website that we're inviting you to visit from today.
We do have one question from John.
Okay, which is, what's that question, please? Willie, can you read it out?
Can't see it. Where's that, Joe?
John, you have to unmute.
Good afternoon, gentlemen. Great presentation. Yes, good afternoon. Great presentation, especially exciting. I found that the messaging created by Pornhub would result in so many requests for help. That's really, really wonderful, because people who ask for help are obviously motivated to make change. Yeah. I would just like to raise a matter of primary prevention. Adverse childhood experiences are well known to generate troubled youth and troubled adults, adults with drug dependency, adults who are abusive and can therefore obviously initiate child sexual abuse. And so the real prevention, primary prevention in my mind, is about a generational shift where we can prevent epigenetic influences. We can generate resilient children just by ensuring that the in utero environment is perfect, that children are parented well. So that was the comment I have, and I wonder if you have any further comment on that. Thank you.
Look, and thank you very much about that comment about adverse childhood experiences, and I would entirely agree with you that there's a strong relationship between those adverse childhood experiences and future behaviours by those who experience those adversities. So no question, and we know that, for example, quite a lot of perpetrators, less to do with the child pornography piece, more to do with contact abusers, will have some experience of adversity in their own childhoods or adolescent years. We know that many, for the relatively small proportion of female perpetrators of sexual abuse, that adverse experiences, including being sexually abused as a child, is often a feature of their childhoods. So that would absolutely play through. I guess so. There are a range of other factors at play, though, which include, there are things to do with genetics. There is an issue about child pornography consumption, but also direct contact sexual abuse being, and whether about children or against adults, being perpetrated majority by males. So there is something about kind of male socialization, but also kind of male genetics, whether we got something to look like kind of for kind of evolution that helps men or males growing up to feel that kind of being sort of kind of more violent, more demanding, more expectant, and to be less respectful is part of the male deal, and we do have to do something to counteract that, and that does include one of my struggles with being a collaborator with Pornhub is I do believe that pornography is a major betrayal of equal relationships, is not helping men or girls, boys or girls across the ages, to learn about respectfulness, about mutuality, about consent. So I do think there are things we need to address that are part of the human condition, but part of the male condition that needs to be part of the remedy. But yes, but I entirely agree about the ACEs needing to be a target for things alongside or as part of that, for sure.
Gentlemen, unfortunately, we need to end. I just got the notification, so.
Thank you. Well, thank you, Joe, for letting us know that. John, thank you.
Thank you.
Others for bringing some comments in the chat. I hope that was of some value to yourselves. Do please get in touch. You gather, we're keen to engage with people wherever in the world you're from. Thank you.
Thank you.